All right, that's good. All right, what we're going to start with, it's your first post-op visit, and you had a 4-centimeter tumor. I took it out, showed you the picture, told you how impressive it was. Did you guys get a copy of the...
Yeah,
all right, so you know it's a benign tumor,
right.
but it was located on a nerve that controls your bicep muscle. So what I want you to do is just tell me what I told you before you had surgery. When you first came to see me from Dr. Boskind's office, you knew already that it was a tumor on the nerve.
Right.
Then what did I tell you I wanted you to do before I took the tumor out?
You wanted me to start icing the place, the actual arm where the incision would be, and also the upper part of the nerve up here, and do that a couple hours a day, morning, noon, and night if at all possible, and also start a supplement regimen.
Right, we use a lot of krill oil.
Yes.
Before we had anything done.
Right.
So tell me, was using the ice difficult pre-operatively or not?
It's probably a little bit to get used to if you're pretty sensitive to that, but using the wraps and all that I used, I think it made it a little more conducive.
Yeah.
I always had like a thin layer shirt on,
Yeah.
but could feel the ice coming through, just wasn't too cold, which made it a little more comfortable and a little more doable.
Right.
And just kind of fit that into my day-to-day routine. I mean, I work in a high school office and would even take the wrap and just wear it while I was working.
Right.
So it was not an inconvenience and didn't cause any problems.
So how did the surgery go?
Surgery itself went well. I think I was surprised by what you just told us about the size, not having any indication about that, but knowing how important the ice was, and reading about that also on your blog, made that a little more doable for me, and knowing
Right.
how important it was, and just knowing that I wanted to have a good healing result. Especially with the nerve issue.
Right. Well, it turned out to be a bigger issue because it was on a much more important nerve than we thought.
Right.
Even beforehand. And did you have a lot of pain from, say, after the surgery?
No, amazingly enough, with the calls from your office, from the hospital, anesthesia and all, this was a piece of cake. I've not had repercussions from the actual surgery itself. It was just another realm with medication that I had a problem with. This part right here, I've not had an issue. Just a little bit of tingling in the fingers.
How long did that last?
Lasted off and on for the last week.
Right.
But that sensation compared to anything I thought as far as pain or being on pain medication, I was actually on extra strength Tylenol for about 2 days, and that was just to kind of give me a calming effect more than it was the actual pain. So
Right.
I have not had any severe pain in my arm at all.
Yeah, and that's the whole point. When you have a tumor this big on a major nerve coming out, of your spinal cord, I would normally have to keep a patient, because I've taken out hundreds of these tumors. I would normally have to probably keep you on pain medicine for at least a month after the surgery. And all you did was use a little bit of ice before, take some krill oil, and how far out are you from your surgery? What day did we operate on you?
Last Monday.
All right, so we're not even a week out, and you're telling me you have very little pain.
Right.
So I guess you're a believer in the ice.
Absolutely. Absolutely.
And it's amazing because it's lights. It not only makes me happy because I can take that information now and make people like you who have these problems not have to be on narcotics and have all the problems associated with it.
Exactly.
Because it can also shorten your recovery time. And I would tell you, I want you to keep using the ice for like the next 3 to 4 weeks. After that, once the symptoms go away, you can pretty much stop using them. I don't think you're going to have to use it long term after that. But if you ever get any symptoms, referable to that again, put the ice on because you'll actually adapt to it a lot faster than you think.
Okay.
All right?
I'm up for it.
All right, cool. That wasn't too hard.